Dr. Stephanie here. I'm a physical therapist and today Hi guys, Dr. Stephanie here. I'm a physical therapist and today we're talking about tailbone pain. So the tailbone is right here, the coccyx bone. It's the lower end of your spine and it's very common to have pain in that area. And it could be due to a fall, it could be due to pregnancy, it could be due to really nothing that you remember. Sometimes you just have pain there, and most likely it's because the pelvic floor muscles attached to the tailbone, also the hip rotator muscles attached there, and so if those muscles are tight or have any tension, then they're pulling on that tailbone, causing pain and discomfort. And even if you sit on a hard surface or sit for too long, those muscles tend to get tighter and cause more pain. So it actually can be caused by sitting too much. If you sit at a desk all day and you don't get up and move often enough, that can create more tension and more pain in that area. So I'm going to go through some exercises that can help you open up the hips, relax that pelvic floor, and hopefully get rid of that tailbone pain. So we're going to start with a yoga block. We're going to do a couple of exercises with this yoga block. If you don't have a block, find a book or something that you can kneel on. Basically, we're going to make our hips uneven a little bit, and that's going to kind of open up the pelvic floor and relax those muscles in there. So for the first exercise, we're going to place this block underneath one knee, and then the other knee is going to be on the floor. You're going to place your hands on the floor here. What you're going to do is the knee that's on the floor is going to move up until it's even with the other one, and then move down. So when it's down, we're creating this length in the pelvic floor, so we're kind of stretching those muscles apart and letting them relax. So you want to just go up and down nice and slow. It's important to do this very slowly. So up and back down, up and down. You want to do that about 10 times. Make sure you go slow, and then you can go ahead and do the same thing on the other side. So we're just lifting that knee up and bringing it down and up and down. So 10 or 15 on the other side. Then we're going to stay in this position, one knee elevated on the block, and we're going to do a cat-cow. So basically we're going to push our spine down towards the floor, kind of arch our back towards the floor. When we're doing that, we're kind of stretching all those muscles of the pelvic floor and the hips. So pause for a couple seconds, and then we're going to push our back up towards the ceiling. Again, kind of stretching out those muscles. Just pausing for a second or two in each direction. So down, and then back up, down, and back up, 10 or 15 times each direction. This one you don't necessarily have to do on both sides. You don't have to switch the block over. If you want to, go ahead and do it, but you don't have to. Okay, so the next one, we're going to do one more with the block. It's called a child's pose with the knee elevated. If you've ever done a child's pose, same thing. We're just going to keep one knee on a block. And that's just keeping some stretch on those pelvic floor muscles, those hip muscles, so that you can kind of open up the hips and pelvic floor. So you're just going to sit back like this into a child's pose. And you just want to breathe in this position for about 30 seconds to a minute. And then come back up and repeat that. So sitting back, holding this position 30 seconds to a minute. Just kind of making sure you're breathing deeply into your abdomen so that we're just kind of opening that pelvic floor, opening those hips. Okay. I want you to put this here. All right, so the other thing that's important is working on hip internal rotation, strength, and mobility. And so we're going to do 2 hip internal rotation exercises. The first one is going to be on your hands and knees. We're going to be in this position, take our feet, bring them out as far as we can, and then back together. Bring them out and together, out and together. And when we're bringing those feet apart, that's really opening up those hips and pelvic floor, giving that tailbone some room, and then bringing them back together. You want to do that about 10 or 15 times, again, nice and slow, just like that. Then for the last exercise, it's also important to work on hip internal rotation strength, because sometimes if those muscles are weak, that can put excess tension or stress on the pelvic floor as well, leading to tailbone pain. So we're going to place a band around our ankles, ball between our knees, lie on your side, and have your knees bent. What you want to do is just lift that top foot up as high as you can and slowly bring it back down. Lift it up and back down, up and back down. For this one, we want to do 2 to 3 sets of 10, and then flip to the other side and do the same thing. So most of these exercises you can do every single day, and it's actually good to do them every day, so we really kind of loosen up that pelvic floor and those hips. The last one with the band, usually I recommend band exercises every other day, so we're just not tiring out that muscle too much. But all of those should relax that pelvic floor, open up those hips, and just relieve some pain and tension around the tailbone.